this is the femur. This is the femur bone, and this is actually the anterior view. So this is the femur or the thigh bone, and in an average man the length of the femur is 45 centimeters. The femur has an upper end, a lower end, and an intervening shaft. Now coming to the upper end, the upper end consists of the head. This is the head. Then we have the neck. This constricted part is the neck. Then this is the greater trochanter. Here the lesser trochanter. Then on the anterior surface we have the intertrochanteric line. This is the intertrochanteric line. And posterior surface we have the intertrochanteric crest. This is the intertrochanteric crest. We will come into the details in a while. Now this is the head. We can see this. This is the head. This is about 2/3 of a sphere and is articular. This articulates like a ball with the acetabular socket of the hip bone and forms the hip joint. This head is covered by hyaline cartilage, except at the center, if we can see, except at the center where there is a pit which is known as the pit or the fovea, where attaches the ligamentum teres femoris. Now coming to the neck, this constricted part just below the head is known as the neck of the femur. This is 5 centimeter long and it is an extension of the basically of the shaft. This neck is directed upward, forward and medially. The neck meets the shaft at an angle. You can see it meets the shaft at an angle of 125 degrees in adult, and it is wider in children, about 160 degree. This elongated neck and the wide neck shaft angle allows the femur or the lower limb to swing clearly away from the pelvis. If we see very closely, we can see oblique bony ridges on the anterior surface of the neck. These are formed by the the attachment of the retinacular fibers of the fibrous ligament. The posterior surface of the neck presents a groove here. This groove is for lodging the tendon of the obturator externus, separated by a bursa. Now this is the greater trochanter. This is quadrilateral elevation that projects upward from the junction of the neck and shaft. This is the greater trochanter. Lies about 10 centimeter below the tubercle of the iliac crest. And the tip of the greater trochanter here. The tip of the greater trochanter, the center of the head of the femur here, and the pubic tubercle on the hip bone, they lie in the same horizontal plane. Now the greater trochanter, it has three surfaces: the anterior surface, the lateral surface, and the medial surface. This is the medial surface. This is this is the anterior view of the femur, and this trochanter, greater trochanter, has two borders also. These are the, if you note, upper border. This is the upper border, and now if you turn the femur here, this is the posterior view. This is the posterior border. This is the posterior border. So this is the anterior surface of the greater trochanter, and it is rough, as we can see it, and it receives the insertion of the gluteus minimus. Now if we turn it to the lateral surface, this is the lateral surface of the greater trochanter, and it is quadrilateral in shape, which is diagonally divided by an oblique ridge running downward and forward. Okay, we see a ridge here, which runs downward and forward and divides this lateral surface into upper triangular and lower triangular parts or areas. Upper triangular and lower triangular areas. Now on this ridge is inserted the gluteus medius muscle, and in the upper and lower triangular areas are the trochanteric bursa for gluteus medius and gluteus maximus respectively. Coming to the medial surface. Here is the medial surface. The medial surface shows a depression. You can see a depression here. This is the trochanteric fossa. Now the fossa receives the insertion of the obturator externus, and here is also the formation of trochanteric anastomosis of arteries. And just above this trochanteric fossa, there is another depression. This second depression, it receives the conjoint insertions of obturator internus, gemelli superior and gemelli superior and inferior muscles. Okay, so these three muscles form the tricipital tendon. Coming to the upper border of the greater trochanter, at the posterior superior angle, there is an inturned end. This is for the insertion of the piriformis muscle. So now if we see on this upper border of the greater trochanter, from behind forwards receives the insertions of the piriformis, gemellus inferior, tendon of obturator internus and the gemellus superior. And the posterior border, it is continuous with the intertrochanteric crest. Now this is the posterior view of the femur, and we can see the lesser trochanter here. It is a conical projection arising from the posteromedial surface of the neck, shaft angle. Okay, the direction is, it is directed, if we can see, medially and backward. Medially and backward. Now, if we turn it, so this is the anterior surface. This near its tip receives the insertion of the psoas major tendon, and towards its base the iliacus muscle, which extends a little into the shaft. Extends a little into the shaft. Here around near the tip on the anterior surface is the insertion of the psoas major, and at the base iliacus muscle that extends into the little into the shaft. Now the posterior surface, it is related to the adductor magnus muscle on the upper margin of it, separated by a bursa. Now we have the intertrochanteric line. This intertrochanteric line separates the anterior surface of the neck from the shaft, and this intertrochanteric line, it is continuous below with the spiral line. You can see it is continuous below with the spiral line. This gives attachment to two ligaments, the capsular and the iliofemoral ligaments, and two muscles. On the upper lateral side, the highest origin of the vastus lateralis, and on the medial and lower part of it gives origin of the, or to the highest origin of the vastus medialis. Now the intertrochanteric crest, this extends from the posterior superior angle of the greater trochanter up to the tip of the lesser trochanter, separating the posterior surface of the neck from the shaft. Now this intertrochanteric crest, it is overlapped by the muscle gluteus maximus, and on this crest we can note a tubercle around the middle of it. This is called the quadrate tubercle, and this receives the insertion of the quadratus femoris muscle. The shaft of the femur, as we can see here, is gently convex in front, because this is the anterior surface, and the convexity is maximum in the middle 1/3, where the shaft is narrowest. Now the shaft of the femur has 3 borders and 3 surfaces. See, this is the anterior surface, this is the medial surface. See, because the head is directed medially, this is the medial surface, and this is the lateral surface. So the 3 borders are medial, lateral and posterior. The posterior border is the posterior, we turn it posteriorly. So the posterior border is the most prominent one, or it has a very prominent crest. This, you can see, has a very prominent crest. This is called the linea aspera. This is called the linea aspera. And we can appreciate that the linea aspera has an inner lip an outer lip, and an intermediate area. Now, in the upper part of the shaft, this linea aspera, the two lips diverge. You can see the two lips diverge to enclose a triangular area posteriorly in the upper third of the shaft. The inner or the medial lip, this is continuous with the spiral line. This is continuous with the spiral line. We can see here. And the lateral lip has a prominent ridge, very notable ridge here, which is also called the gluteal tuberosity. Similarly, in the lower part posteriorly, as we can see, the two lips of the linea aspera, they diverge and enclose or give rise to a triangular area here, which is also called the popliteal surface in the lower third of the shaft. Now, if we see the medial lip, it is continuous below with the medial supracondylar ridge. The medial supracondylar ridge. And the lateral lip is continuous below with the lateral supracondylar line. This lateral supracondylar line is more prominent than the medial supracondylar line. So basically, this shaft can be said that it has 5 surfaces: anterior surface, medial surface, lateral surface, and posterior surfaces in the upper 1/3 of the shaft and the popliteal surface in the lower third of the shaft. Now the upper 3/4, this all of the upper 3/4 of the anterior surface of the shaft along with the adjoining lateral surface provides origin to the vastus intermedius muscle, and just below it lies the origin of the articularis genu by a few small slips. The medial surface, it is overlapped or covered by the vastus medialis muscle, and the origin of the muscle, it lies along starts from the lower part of the intertrochanteric line, then along the spiral line, then the medial lip of the linea aspera till up to upper 2/3 of the medial supracondylar line. The origin of the vastus lateralis is linear. It passes along the upper part of the intertrochanteric line, then along the anterior and lower part of the root of the greater trochanter, then along the lateral margin of the gluteal tuberosity, then the lateral lip of the linea aspera, extending right up to the middle of the femoral shaft. this gluteal tuberosity, this receives the insertion about 1/4 of the fibers of gluteus maximus. Now, along this linea aspera and its diverging lips, we have the structures, a few structures that are attached to it from medial to lateral. Most medially is the vastus medialis. Then comes the medial intermuscular septum. Lateral to that in the upper part lies the origin of the adductor brevis, in the lower part adductor longus, more lateral to that the adductor magnus. Then the posterior intermuscular septum is attached to the intermediate area. Lateral to that, mostly in the lower part and up to the upper 2/3 of the lateral supracondylar line, is the origin of the short head of the biceps femoris. More lateral to that, along the lateral lip, is attached the lateral intermuscular septum, and the lateral most structure to that is the vastus lateralis. Now, as for the lateral and the medial borders of the femur, shaft of the femur, we see that these are rounded. Basically, these are arbitrary lines separating the surfaces. And the linea aspera, in fact, is formed by fusion of the 3 primitive borders. This is the linea aspera, we have already seen it. And it's formed by fusion of the 3 primitive borders, where all the intermuscular septa of the thigh converge. The posterior surface in the upper 1/3 of the shaft between the spiral line and the gluteal tuberosity, it gives attachment to the following structures from medial to lateral. Note, this is the head, so this is from medial to lateral. They are the vastus medialis, a part of iliacus, pectineus, adductor brevis, adductor magnus, and gluteus maximus. Now, this lower part of the posterior surface of the shaft is the popliteal surface between the medial and the lateral supracondylar lines, and this actually forms the upper part of the floor of the popliteal fossa. And the popliteal vessels, they basically pass downward and laterally and rest on this surface separated by fibrofatty tissue. The inferomedial angle of the popliteal surface, as we can see here, it is rough, and this gives origin to the medial head of the gastrocnemius muscle. If we see here, this is the lateral lateral supracondylar line, and so this is the lateral or inferolateral angle of the popliteal surface, and close to it here along the lateral supracondylar line is the origin of the plantaris muscle. This is gastrocnemius, this is plantaris. Now, the medial supracondylar line, it goes right up to an elevation or tubercle. This is known as the adductor tubercle. Now, this medial supracondylar line, the medial supracondylar line, it gives attachment to three structures: the medial intermuscular septum, here the medial intermuscular septum, then the adductor magnus muscle along the entire length except where there is opening for the passage of the popliteal vessels, which are a continuation of the femoral vessels, and the vastus medialis, which is the medial most structure here, right up to the upper 2/3 of the medial supracondylar line. Similarly, the lateral supracondylar line gives attachment to three structures: the lateral intermuscular septum along the entire length, then the short head of the biceps femoris in the upper 2/3, the origin of the muscle, and the plantaris and the origin of the plantaris in the lower 1/3. Now the lower ends, coming to the lower end of the femur. The lower end, as we can see, is enlarged and has two condyles. See, medial condyle and lateral condyle. The lateral condyle is larger than the medial condyle, as we can see, and these condyles form the knee joint after articulating with patella in front and with the corresponding condyles of tibia in tibia below and behind. These condyles, they project backwards. Now if I turn this, you can see this is the posterior surface, because this is the linea aspera, and see these are projecting backwards and are separated and by the intercondylar fossa, The outer surfaces, as we can see, the outer surfaces are rough, and the point of maximum convexities are called the epicondyles. See, a V-shaped articular surface affects the anterior, inferior and posterior surfaces of both the condyles. The apex of the V is known as the patellar surface because it articulates with the patella, and it occupies the anterior surface of both the condyles. Rest of the articular surface articulates, it's known as the tibial surface, rest, because it comes in contact with the corresponding condyles of tibia separated by a meniscus. Now this is the lateral condyle. So this is the lateral epicondyle. This gives attachment in the upper part to the fibular collateral ligament. The fibular collateral ligament here. And in its lower part, we can see a groove, curved groove. This is the posterior, this is the anterior. So in the anterior part of the groove lies this anterior part gives the attachment to the popliteus muscle here. And in this posterior part of the groove is for the tendon of the popliteus muscle in the flexed position of the knee. Above this groove Above this groove, there is another depression behind the lateral epicondyle, if you can see it here. This depression is for the origin of the lateral head of the gastrocnemius muscle. Now we see this is the medial condyle. Here on its outer surface, this is the medial epicondyle. This medial epicondyle gives attachment to the tibial collateral ligament here, tibial collateral ligament. And we can see at the lower end of the medial supracondylar line, this is the adductor tubercle. Now this adductor tubercle is unique in three ways. Adductor tubercle is unique in three ways. First, it receives the insertion of the tendon of ischial part of the adductor magnus. The epiphyseal line of the lower end of the femur, it passes through this tubercle, and finally it forms a bony landmark for surface marking. Now between the two condyles is the intercondylar fossa. Presents a medial surface, lateral surface, and a floor limited by the upper and lower margins. Now the medial wall, this gives attachment to the upper end of the posterior cruciate ligament, and the lateral wall, it gives attachment to the upper end of the anterior cruciate ligament. This upper margin, it provides attachment to the fibrous capsule and the oblique popliteal ligament. The lower margin gives attachment to the apex of the infrapatellar synovial fold. Now coming to the anatomical position of the femur. The head is placed upward, medially, and slightly forward. And see, note that the convexity of the shaft is in the front. The lower surface or the lower end has the femoral condyles in a horizontal surface, so that the direction of the shaft of the femur is oblique, sloping downwards and medially. And anterior posterior, we can decide by the presence of the linea aspera posteriorly